Alexithymia is a different way of experiencing emotions. People with alexithymia have difficulty identifying and describing their feelings. Imagine a world where you struggle to label emotions like joy, sadness, or anger. This is the reality for individuals with alexithymia. They might feel internal sensations, but they lack the vocabulary to express them clearly. The term alexithymia originates from Greek roots meaning no words for feelings. This name accurately reflects the core challenge of this condition. It's crucial to understand that alexithymia is not a choice. It's a personality trait that affects how individuals perceive and interact with their own emotions and those of others. This difficulty in understanding emotions can lead to challenges in social interactions. People with alexithymia might misinterpret social cues or struggle to empathize with others effectively. This can result in misunderstandings or difficulties in forming and maintaining relationships. It's also important to distinguish alexithymia from having no emotions. People with alexithymia do experience emotions, but they struggle to recognize and articulate them. Imagine feeling a wave of sensation but not knowing whether it's happiness, excitement, or anxiety. This internal confusion can be incredibly isolating and frustrating. Alexithymia is more common than one might think. Research suggests that it affects a significant portion of the population. Studies estimate that about 10% of people experience alexithymia to some degree. However, this number can be even higher in specific groups. For instance, alexithymia is more prevalent in individuals with certain neurological conditions. Multiple sclerosis is one such condition where a high percentage of patients also experience alexithymia. This co-occurrence highlights a potential link between neurological pathways and emotional processing. Furthermore, autism spectrum disorder is another condition where alexithymia is frequently observed. In fact, studies indicate that the prevalence of alexithymia in autistic individuals can be significantly higher, ranging from 40% to 65%. This connection suggests a complex interplay between social cognition, sensory processing, and emotional regulation in autism. The impact of alexithymia extends beyond just the individual. It can also affect families and relationships. Since individuals with alexithymia may struggle to express their emotions, loved ones might feel confused or frustrated. This lack of emotional understanding can create distance in relationships and make it challenging to provide adequate support. Identifying alexithymia can be challenging, as it often goes unnoticed or is mistaken for other conditions. Many individuals with alexithymia may not even realize they experience emotions differently. They might describe themselves as logical, rational, or perhaps even emotionally flat. However, this perceived lack of emotion is often a result of their difficulty in identifying and verbalizing their feelings. To diagnose and assess alexithymia, healthcare professionals use specific tools and questionnaires. One commonly used tool is the Toronto Alexithymia Scale. This self-report questionnaire consists of 20 statements that assess different aspects of alexithymia, such as difficulty identifying feelings, difficulty describing feelings to others, and externally oriented thinking. Another assessment tool is the Berman-Dvorst Alexithymia Questionnaire. This questionnaire delves deeper into the cognitive and affective aspects of alexithymia. It explores the individual's ability to fantasize, their emotional awareness, and their capacity for emotional empathy. While these questionnaires provide valuable insights, it's essential to remember that they are just tools. A comprehensive evaluation involves considering an individual's personal history, behavioral observations, and potential co-occurring conditions. The field of alexithymia research is continuously evolving. As we gain a deeper understanding of the brain and its intricate workings, we uncover new avenues for exploring and addressing alexithymia. Current research focuses on several key areas that hold promise for future interventions and support strategies. One area of interest is the development of more targeted therapies. While there is no one-size-fits-all approach, therapies like cognitive behavioral therapy and mindfulness-based interventions show potential in helping individuals with alexithymia improve their emotional awareness and regulation skills. Another exciting avenue is the exploration of the brain's role in alexithymia. Neuroimaging techniques such as fMRI allow researchers to observe brain activity in real time as individuals engage in emotional tasks. These studies aim to pinpoint specific brain regions and neural pathways involved in emotional processing and regulation in alexithymia. Furthermore, researchers are investigating the genetic and environmental factors that contribute to alexithymia. Understanding these factors can shed light on the underlying mechanisms of the condition and potentially pave the way for early identification and intervention strategies. In conclusion, alexithymia is a complex and often misunderstood condition that significantly impacts the lives of many individuals. By fostering greater awareness, conducting further research, and developing effective interventions, we can empower individuals with alexithymia to navigate their emotions and live more fulfilling lives.